Hello, good afternoon. Welcome to another presentation today through Agent Advantage. And I am Donna Mitchell, welcoming Miss Issurah King today. Through the local grants and donations, we offer programs to help with effects of COVID and other post-pandemic situations like housing and food insecurity or isolation. And through these partnerships, we provide educational topics that can help promote self care and resilience. Today, we're going to have a speaker, Issurah King. She's going to come and talk with us today about overdose education and Naxalone distribution and training. So, once she's completed, we'll come back and we can answer any questions, any comments, questions, concerns. We can tackle it at that time. But for now, let's give her our attention. Issurah, go right ahead. Thank you.
Right. Thanks so much for having me. I'm Issurah King, and I'm with St. Louis County Department of Public Health. And I'm really excited to get into this topic with you for overdose education and naloxone distribution. So, some of the topics that we'll talk about is what are opioids and opioid use disorder, how it's impacting St. Louis County specifically, harm reduction, signs and symptoms of opioid overdose, what naloxone is and how to use it. It's also called Narcan, and as well as the community distribution program that we have for naloxone. So to start off with, what are opioids? Opioids are prescription pain pills, such as oxycodone, oxycontin, hydrocodone, Vicodin, codeine, morphine, those types of medications. You may be familiar with these if you've had some type of surgery, whether like wisdom teeth removal or knee surgery, things like that. Oftentimes when you have a invasive surgery, you're sent home with prescribed opioids to help with pain management. There are also illicitly produced opioids such as fentanyl that's produced on the streets, and that or heroin. And so we are very much concerned about not just like fentanyl and heroin, but also other drugs as well. But opioids is what causes the drug overdose, and that can be reversed via naloxone. So we'll talk about that a little bit more. So some non-opioid drugs, just so that you know, there's lots of over-the-counter medications that's used for pain, Tylenol, steroid medications, things like that. So these are things that you don't have to worry about in relation to, opioid overdose specifically. Then there are other drugs that can be misused or abused, or even are illicit. So you see here benzodiazepines, Xanax, Klonopin, cocaine, alcohol. The thing with opioids is that they are, a lot of people do what's called polysubstance use. So they'll mix different drugs together, and that can increase the risk for overdose when people are doing that. In relation to how opioid use disorder impacts the brain, the U.S. Department for Health and Human Services defines opioid use disorder as a chronic disease that involves a problematic pattern of opioid use that causes significant impairment or distress, sometimes referred to as a substance use disorder or opioid addiction. So we know that certain factors put people at a higher risk for opioid use disorder and developing a dependency on opioids. So some people might start off as just being prescribed a medication for pain management. And then what happens is, maybe there's chronic stressors around that they're not having any other type of outlet for, and they start leaning into the opioids more so for, instead of just for for physical pain management, to help alleviate their emotional stress. And so that could be a factor. Also, if there have been other people in the family or home that have had substance use challenges, that can also be a factor that could contribute to developing an opioid use disorder. So the Health and Human Services states that the initial decision to take drugs is voluntary for most people, but can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. So basically, the brain is taken over, the receptors in the brain begin to believe that it needs this drug to survive. And that's why it becomes more and more difficult to not use the drug. So, we talked a little bit about this. So factors including stress, trauma, exposure to other drugs. So especially like, even if it's just heavy, like alcohol use or things like that, that could be a contributing factor. Family history, chronic pain, and lack of coping skills. But the good news is that there are medications that are used to treat opioid use disorder. There's methadone, buprenorphine, plus naloxone called Suboxone, as well as Vivitrol. So these medications, we refer to this type of treatment as medication assisted treatment. St. Louis County does have a medication assisted treatment program. And we also have social workers that are involved with helping people to get connected when they need this. We know that basically what happens is when you use one of these medications, it helps to reduce the withdrawal symptoms and helps that process of not using substances to become more easy for people that are trying to get off of substances. Okay, so I'll just go through this real quick. Which of the following is not a risk factor for developing a substance use disorder? A regular use of substances at an early age. B, certain untreated mental health conditions. C, family history of addiction. Or D, being actively involved in extracurricular activities. I'll just pause for like a moment while everybody thinks about it, and then I'll reveal the answer. So the answer is D. So having, active involvement, like young people being actively involved in extracurricular activities, definitely helps them to have something else to look forward to. We know that teenagers are often exposed to different types of drugs, and we want to make sure that they have options in regards to how to spend their time and things like that. And then even adults that have hobbies or activities that they participate in, that can be very stress relieving. So having that coping skill, to relieve stress, whether it be drawing, coloring, going for bike rides, or whatever it might be, can also help you to have a healthy outlet for stress. So which group lists examples of opioids? So let's see. When we talked about the different types of opioids, we had, you guys probably remember, and most people probably know that, well, Tylenol or acetaminophen is not an opioid. So therefore, group 1 that has the Oxycontin, the fentanyl, these are the different types of opioids. So now we get to harm reduction. And this is something that is very important to St. Louis County and also to my specific team, the Overdose Data to Action local team. There are 8 principles of harm reduction. So harm reduction is something that was developed years ago by people who were using drugs and seeing their friends suffer and die because of addiction and addiction related issues. And so harm reduction is not a way to promote drug use, but it's really to help people through those steps towards recovery, while also acknowledging the harms associated with drug use and the consequences of drug use. So we know that trying to force people into treatment is not something that is effective. A lot of times, even if getting that person into treatment works at that time, the risk for relapse increases until someone is actually ready. So harm reduction helps us to give safer approaches as we work towards the goal of sobriety. So we try to be non-judgmental and not be coercive, make sure that people maintain their autonomy and their choice in regards to how they want to deal with their situation during that specific time. ensuring that people who use or have used drugs in the past have voice in creation of programs and policies. So with St. Louis County, we partner with a lot of community organizations that are employing people that have a history of substance use, and we work together with them with their expertise to figure out how we can make programs more effective for people that are looking for treatment. We also understand that there are impacts of poverty, class, trauma, and racism and other social inequalities that factor into the development of substance use disorders, as well as like what type of treatment are accessible to people. So we know that, for example, there have been law enforcement assistant diversion programs to divert people of that are being accused of nonviolent crimes and divert them towards treatment. But we also know that oftentimes there's an inequality in regards to who's been diverted. So we work together with the criminal justice system, the prosecuting attorney's office, to try to bring more equity to these types of programs to make sure everyone has better access. Um, and so this is a really empowering approach to helping people. One of the main philosophies of harm reduction is to meet people where they are in their pattern of substance use. So, this here diagram on the right, it shows like whenever someone is in a process of change, there are different stages. We go from pre-contemplation, where we don't really recognize there's a problem. So if someone is using drugs, they might just think, I'm having fun, I'm relaxing, nothing's happening bad in my life, there's no problem. Contemplation is when you begin to consider a change. So that sometimes might be sparked by maybe someone got a bad batch of drugs and they didn't feel well, or maybe because of their substance use, there was some type of consequence. Maybe they got in trouble at work, or they're facing having their children taken away. So now they start thinking maybe this is a problem. Preparation is when you get ready for the change. You get ready to make the change. You're looking for groups, near support groups, treatment options. You're figuring out your transportation, your childcare, all of those different factors to see how you can get started with that journey of sobriety. Actions is when you are actively engaging in the actions for sobriety, going to meetings, attending those medication appointments, and then maintenance is just maintaining that lifestyle. At any point in this cycle, somebody might slip backwards, relapse happens, and it doesn't mean it's a failure, but that, this person might just need to go back to that stage. And the important thing about these stages is that professionals are able to recognize these different stages of where people are at and use different strategies to help move them forward to the next part of the cycle. So another thing with harm, so that's how we meet people with like where they're at in their substance use. The other point here about safer use to limit disease transmission. So we know that, like, for example, people use drugs in a variety of ways. They might smoke, they might inject, they might snort. And so there's different risks associated with the different methods. With smoking, so if someone is using drugs, smoking is less risky than injecting because there's not as much of a risk of transmitting viral infections when sharing needles. And then also, because of the method of delivery, there's a lower risk of overdose in regards to that. And the same thing with snorting, that actually has a higher risk of overdose than smoking. So we want to educate people how to prevent diseases that could last a lifetime, as well as how to limit the risk of overdose if they are choosing to continue to use. So we know that harm reduction doesn't mean completely stopping drug use, but using drugs in a less risky way can help to have healthier outcomes down the line and can prevent fatal overdoses. We also want to be mindful of language. So don't use words with people such as addict or people who use, I'm sorry, don't use words such as addict. Instead, use words such as people who use drugs or a person who uses drugs. We don't want to assign a title um, or a definition to someone just based on one thing that they do, because they can't overcome that. And then also, don't use words like clean if someone is, has stopped using drugs. Use instead a word like sober, because if you say clean, then if they go back to using drugs, and then that insinuates that they're dirty. And so we just want to be mindful of language. So this is a little bit more about like the language impacts of stigma. So not stigmatizing people. This is a very big aspect of one of our current initiatives with the Overdose to Action local grant. So you have some examples here, a little bit more about like what is non-stigmatizing language. And so you can just take a look here. You see person in recovery or someone who's abstinent from drug use. These are all positive ways to speak about someone. So now we're going to get into the naloxone administration for suspected opioid overdose. So first, the important factor first is to be able to identify the signs and symptoms of overdose. So here are some of the like hallmark signs: small constricted pinpoint pupils, losing consciousness, so completely unconscious, slow, weak, or no breathing, choking, gurgling, or snoring sounds, limp body, cold and or clammy skin, and skin discoloration. So that may look different depending on skin tones, gray or ashen, or blue or purple. So these are the signs and symptoms of overdose that we're looking for. And if you recognize these signs and symptoms, then this is what you can do. You can grab some naloxone, and this is pictured here as the name brand Narcan. That's very popular. The nasal spray naloxone looks just the same. The box is just a little bit taller and skinnier, but the applicator is exactly the same as in this photo. So naloxone is a rescue medication that rapidly reverses life-threatening opioid overdose. It cannot be used to get high. This nasal medication, it goes into the nose, into the nostril. So there's no injections or needles involved. And it's just 4 milligrams of the naloxone medication. And it takes about 2 to 3 minutes to take effect. And then it wears off within 30 to 90 minutes. It's available in all states. It's legal to carry, and you don't need a prescription. So getting into reversing overdose. First, you want to check for signs and symptoms of the overdose. So look for those dilated pupils, someone that has that gurgling sound in the back of their throat. They're completely unconscious, they're breathing. If you notice those signs, call their name or shout out, "Are you okay?" Then check for a pulse. If there is not a pulse, then first administer CPR before administering Narcan. And then, yes, you want to be able to like administer the CPR, because the naloxone or the Narcan is absorbed via the bloodstream, and it can't be absorbed if the person doesn't have a heartbeat. So if there are multiple people that are at the scene, one person can do the artificial chest compressions while somebody else administers the Narcan, and that can help to pump the medicine through the bloodstream. But if there's just one person, focus on trying to get that heartbeat first, and make sure that you call 911 immediately. Just a quick note in regards to calling 911. You want to focus more so on just sharing the symptoms with the dispatch. Tell them someone's unconscious, they're not breathing, share all of the symptoms. especially if you're not 100% sure if this person is actually having an overdose or a different medical emergency, because unfortunately there is stigma even with emergency response, and we just want to make sure that the needs of this person are tended to properly. So just focus on sharing those symptoms. Steps to reverse an opioid overdose. So you open the packaging, you hold the applicator as shown in the picture with your index finger and middle finger on top and thumb on the bottom plunger. You place the Narcan in one nostril and then you press the plunger. You don't need to like prime the pump. You don't need to pump multiple times, because as soon as you press that button, it releases the medication all at once. So if you press it before it's in that person's nostril, then you've wasted the medicine. So make sure it's already that the applicator tip is in the nostril. Then once you've applied the medicine into the nostril, lay the person on their side with the top leg bent so that they don't roll over, and that just prevents choking if they wake up and start vomiting. If this person does not wake up within 2 to 3 minutes, then you're going to have to administer a second dose of Narcan into the opposite nostril. With the potency of fentanyl increasing on the street, there have been reports that people are needing two, more often two, sometimes even 3 doses of Narcan before they come out of that overdose. And just a reminder, when not to use naloxone, when there's no breathing and no pulse, you must administer chest compressions first. And don't interrupt the chest compressions for breathing or naloxone administration. Again, if there's multiple people, you can divide tasks, but if it's just one person, this is what you're focusing on. Administer the naloxone only after getting a heartbeat or an artificial heartbeat from chest compressions, and then continue to do that until the emergency response arrives. Some of the symptoms, side effects of naloxone are listed here. They are rare, but it's possible. Many of these side effects are simply just the side effects of coming down off of the high. So there, and also another note is that less than 1% of the population is allergic to naloxone. Again, one of the first steps that you're doing is calling 911. So, if there's another medical situation that needs to be addressed, then the medical professionals can address that. But reversing the overdose will help to preserve that person's life, because the opioids is sitting on the receptors of the brain that stimulates breathing. And so, of course, without being able to do that, that person would completely pass away. So this is like triaging the order of importance of the issue. There's a overdose, we're going to deal with that. And then in regards to other situations, the emergency personnel will get them to the doctors that will help with that. So possible naloxone side effects: anger, irritability, vomiting or sweating, tremor, sweating, headache, seizures, rapid heart rate, changes in blood pressure. Again, many of this is just withdrawal symptoms and that person coming down from that high. If there are no opioids in the system, if you're thinking you're seeing an overdose and it actually was something completely different and you haven't done harm, there's no impact on the person. People who are given naloxone should definitely be observed until the emergency cure arrives, and they should see a medical professional afterwards. So a couple of questions that sometimes come up. Can naloxone reverse any drug overdose? And no, it's just for opioids. So it's not for it's not like if you accidentally take too much over-the-counter medicine or these other types of drugs that we talked about earlier. But again, just highlighting the fact that more frequently people are mixing different types of drugs together So even if someone thinks that they only have Xanax, maybe they think they just bought a Xanax pill from a friend or someone off the street, and they have like what appears to be overdose symptoms, it is a good idea to use the naloxone, because sometimes the people that are having those pills they're mixing it with fentanyl or another type of opioid. So a couple of things that increase the risk for overdose is like if someone has had a previous overdose, that kind of might be an indicator that they just use a high amount of substances that causes overdose. History of substance use or misuse is another risk. A couple other things. We talked about the method of using drugs, so injecting is a higher risk. Um, and then people who have had a period of like stopping drug use, so whether they were incarcerated or they tried going to rehab, or even a postpartum mother who has had a history of substance use and stopped using during the pregnancy, if any of these people go back to using substances at the same amount that they did before, their tolerance has decreased and their risk for overdose increases greatly. So these are just some things to think about and some people to keep in mind if you know anybody in this situation. So a couple of things that we talk about as well, like to reduce the risk of overdose. We encourage people to not use alone, and taking turns when using with a partner so that one person can respond to possible overdose. Avoid mixing substances, but again, this is something that a lot of people don't know is happening, especially if they're just buying drugs off the street. Um, and there's also drug checking strips, like fentanyl testing strips. County gives those out. And then keeping naloxone on hand. Um, and um, and then also, if you're ready for sobriety, then we can do those medications for opioid use disorder or those medication assisted treatment that we talked about earlier to help you get off of the dependency of opioids. So again, I'll just pose the question and then I'll pause and then I'll reveal the answer. So which of the following is true about naloxone for opioid overdose? A, it is only available through prescription. B, it increases the effects of opioids in the body. C, it reverses the effects of opioids on the respiratory system. Or D, it is a long-term treatment for opioid use disorder. So I'll pause for a few seconds. Okay. So if you remember, I briefly mentioned that the opioids act on the receptors in the brain that control the breathing. So the answer is C. It reverses the effects of opioids on the respiratory system. And so just to highlight a couple of things, in regards to the availability, you don't need a prescription for naloxone. It reverses naloxone does reverse, not increase, the effects of opioids in the body. And it is actually not a long-term treatment. It is just an emergency agent used to reverse fatal overdose. And long-term, Suboxone is a medication that incorporates naloxone to be used as a long-term treatment, but it also has Vivitrol as well. And then there's other medications for long-term treatment to help someone with opioid use disorder. Some people have questions about like the legalities. We talked about how naloxone is legal to carry. And also, and when you are seeking help for somebody, there are laws that protect you. So the Missouri Good Samaritan law says that if you're seeking medical assistance for an overdose or other medical emergency, that you are protected under the Good Samaritan law, and you even have immunity from different certain crimes. So let's say possession. So the crimes that you have immunity from include possession of a controlled substance or imitation substance, possession of paraphernalia, violating a restraining order or parole, maintaining a public nuisance, alcohol sale to a minor, or purchasing alcohol by a minor in possession of an altered ID. So if you're in possession of paraphernalia and your friend is having an overdose and you're afraid to call 911, this law states that you have immunity in relation to that specifically. It is important to note, though, that this does not protect you from crimes such as distributing controlled substances or manufacturing drugs or active warrants. So if you are that person and your friend is having an overdose, you should definitely call for help, but probably leave before the EMS arrives or the police arrive in relation to those things. And then the legal protection for administering naloxone. So specifically administering naloxone, if you provide the opioid antagonist and immediately after contact emergency personnel and you've acted in good faith with reasonable care, then you're immune from criminal prosecution, disciplinary actions from professional licensing board, and civil liability due to the administration of the opioid antagonist. So that's another protection there if you're administering the naloxone to someone and you're worried about whether or not you could have any type of liability there. So so we do these education trainings regarding naloxone, overdose, and all of these things at St. Louis County for individuals, organizations. We also have other trainings that are coming up about more specifically focused on anti-stigma as part of the Overdose Data to Action Local Grant that I am currently under. So we will have more availability of trainings as well. And then we have the naloxone distribution program. So we don't just talk about naloxone, we give it out. We mail it to anywhere within St. Louis County. You can use this QR code to request mail out. We also distribute the naloxone at our county clinics. So North Central and Pine Lawn, John C. Murphy in Berkeley, and then the South County Clinic on Lindbergh. And then we also have naloxone kiosks and naloxone vending machines throughout the county at various locations as well, such as barbershops, some food pantries. So anywhere you see a county branded box with naloxone, you can just feel free to grab it, or you can request mail out if you live in St. Louis County. And so this is just a little the addresses of our health centers that have the naloxone, and you don't have to use an ID because you really just grab it yourself at this point. You grab it from the kiosks that are there or the vending machine. And then also all St. Louis County library locations have naloxone from us as well. And then finally, I wanted to share that in addition to our harm reduction with naloxone, we give out quite a few other things as well. We have some kits based on funding and availability. We have personal hygiene kits. We have wound care kits, sexual health kits, the overdose reduction kit that has naloxone and fentanyl test strips, the safer smoking kit, and then the safer injection kit. And these are these are just the contact information, myself, the community health manager, and then a few of our websites. And that is pretty much it. And we appreciate you guys for having us today and for allowing me to speak on this topic. We want to save lives in St. Louis County. We know we've seen data that indicates that overdose rates are declining in St. Louis County. So the work, not just that we're doing, but a lot of community coalitions are doing, is making a huge impact in saving lives and having healthier and safer communities. And so giving more information out like this also helps to spread that information and increase the health of our communities.
Yes, I 100% agree with you. And thank you once again for coming on and sharing such great information that I'm sure somebody out there can use for somebody else, whether it's for themselves or someone else that they know, a loved one, friend, somebody on the street. You just never know. That's why I was so adamant about getting you back on, because I know this is something, like you say, it's really increasing in St. Louis County, city, just all around us. And I'm even seeing that, the age bracket is getting younger and younger. And so most definitely this is something, well, very much needed.
Absolutely.
Thank you once again. I
Thank you.
appreciate it. Let me see if we have any kind of questions or comments at this time. Doesn't look like it, but of course, at any time someone wants more information, as Isra said, you can always look to any of those health departments to receive the information that you need. And if you need to contact Aging Advantage so that we can put you back in contact with Isra or the appropriate authorities, then please, by all means, reach out to us. We're here. We want to help. We want to be some type of resource for you, reference guide. So it's great. Thank you once again. Um, do you, by any chance, Israel, know of any similar programs in the city?
Hmm. That's a good question. I know that some of the smaller organizations that we work with, or I'm sorry, not smaller, but but private organizations that we work with do work, I believe, in the city. Prevent Ed has a lot of great resources,
Okay.
as well as Mo Network has some resources, but Prevent Ed definitely does trainings and things like that. They're a great partner. Um,
Two. Okay. All righty. Because a lot of our clients that we work directly with are in the city. And
okay.
so I just wanted to make sure that, them seeing this and viewing this, it's great information, but I do want to know, make sure that they have an opportunity or resource that they can go to and receive the same benefits and opportunities as those who live in St. Louis County as well.
Yes.
So
Oh,
that's why I was asking that question.
another
Um,
another one too is Power for STL. They give out
Power
harm
for
reduction
STL.
resources in the
Okay.
city, and they do a lot of outreach as well.
Okay. Okay. That sounds good. We will do that as well then. Okay. Well, if we have no other questions, then let's just make sure we double check here, make sure we have no other questions. Well, maybe it's not what I needed. I don't think I needed that. I was just trying to make sure that I would have access to it later. I think we are okay.
Yeah.
All righty then, Miss Isra. Well, we will most definitely be in contact with you for future opportunities, because most definitely you are in a field that we can use more information and
Yeah.
topics that you have to share with our communities. And again, thank you so much for your time and this opportunity to come and share with us. You have a wonderful weekend. All right. Enjoy the
Thank
rest of your day.
thank you
Thank
so
you.
much, Miss Donna. I
You're
appreciate you, and
welcome.
I'm always happy to come back. I definitely would love to share some more of the trainings that we'll be developing soon.
Okay, sounds good.
Okay.
Thank you. Take care. Have a
You
good
too.
day.
Bye-bye.